Good day, everyone. My name is Bijan Kimirgar, and I'm the Associate Executive Director for Research at Citizens Committee for Children of New York. For those of you joining us for the first time at one of CCC's webinars, welcome. A brief introduction to all of us at Citizens Committee. We are an independent and nonpartisan child advocacy organization. We combine public policy research and data analysis with citizen action to engage policymakers, service providers, and the public at large to promote practical solutions that ensure every New York City child is healthy, housed, educated, and safe. Today's webinar is a resource for anyone and everyone working to address the needs of children and their families, and specifically the need for high quality, affordable childcare for infants and toddlers. The findings that we will share bear the challenge New York City was facing a childcare affordability crisis even prior to the COVID-19 pandemic, and the economic disparities the pandemic has exacerbated and accelerated. However, the findings from our analysis and the policy implications we will share are informed by the pandemic and how expansion of access to affordable infant and toddler care is critical at this time. A few numbers we should have in mind as part of the discussion today. There are 500,000 children under the age of 5 living in New York City, and half of these children, or about 250,000, live in households with incomes below or near the federal poverty level. But only half of these children, so about 120,000, were enrolled in the public system of early education and care in New York City. New York City has made important strides in expanding early education access for 3- and 4-year-old children, and now we need action at all levels of policymaking, federal, state, and local, to ensure access to education and care for infants and toddlers that supports their development and supports their parents' and caregivers' employment stability and economic mobility. I want to remind all of you who join us that while you may be muted during the presentation portion of the webinar, you are essential to the conversation. So please put your thoughts, comments, questions in the chat or the Q&A form throughout the presentation. We'll be addressing them at the end of the discussion today, and if we don't address them during the webinar, we will follow up with an email after the session. I also encourage you to join Citizens Committee for Children's e-Action Network to receive updates when we release new research and policy advocacy resources, and engage with us on social media. We are on Twitter, Facebook, and Instagram at CCC New York, and we'll put these links in the chat as well. With this, I'd like to introduce our presenters today. Next slide, please.
I actually did it. I'm not sure if you see.
Let's see. Here we are. Again, I'm Bijan Kimirgar, and I'm joined today by Maria Drobniak, Senior Research Associate for Data Resources, as well as Daryl Hornick-Becker, Policy and Advocacy Associate. And I should mention that a member of our team, Sophia Halkidis, data analyst on CCC's team, was also a co-author of the brief that we released and completed the lion's share of the analysis we're sharing with you today. Next slide. We'll be going over 3 components during the presentation today. The first are the 2 economic dimensions of access to childcare for infants and toddlers that we look at: childcare cost burden and affordability. I'll be going through this with you all. Next, Maria will go over the geographic and demographic trends that we see for these 2 indicators, looking specifically at household composition, whether a family with young children is headed by a single parent or a married couple. Also looking at the geographic distributions by city and borough, and also our analysis looks specifically at community districts and seeing the differences between neighborhoods in parts of the city. And Daryl will be going over policy considerations at the federal, state, and local level. Just as a reminder, all the slides we will share with you, for those of you that registered afterwards, you'll receive an email. So if there's any questions, feel free to ask them, but don't worry about taking too many notes on the slides themselves. Next slide, please. So I'll begin with the 2 dimensions of childcare access, economics specifically, childcare cost burden and affordability. One report that we use to create both of these indicators is the New York State Childcare Market Rate Survey Report. It is a random survey of childcare providers throughout the state, and we use numbers specifically for the New York City counties. There are rates for infants, toddlers, and separately for 3- and 5-year-olds. For our analysis, we average the infant and toddler rates for both center-based and home-based care to get average weekly rates, and then calculate this up to have an average annual rate. For center-based care for infants and toddlers on average, it's $18,746 based on this 2019 report. And for home-based care, it's $10,296. This is the 69th percentile of rates. It's important to note that there are recommendations at the federal level that suggest the 75th percentile of reported rates should be used for the subsidy payments. Next slide, please. We also use information from the American Community Survey. This specifically is from the public use microdata sample files, where we use to calculate the median incomes for the community districts, as well as for the specific households, whether single parents, married couples, or combined, looking at all families. We see that there are big differences in the median incomes depending on the household heads, with single parents averaging a median or having a median income of $34,800 and married couples having around $80,000, excuse me. We use both the New York State market rate report and these PUMS files to create both the cost burden and affordability indicators that we'll be sharing with you today. Next slide. For these, we define cost burden as the share of median household income for families with at least one child under 5 years of age that would be consumed by either center-based or home-based childcare for infants and toddlers. Separately, we calculate an affordability indicator, which looks at the share of families with at least one child under the age of 5 for whom care would cost no more than 7% of their household income. This threshold of 7% is actually recommended by the US Department of Health and Human Services as part of their co-payment plans. Next slide. Both of these indicators are available on our website, data.cccnewyork.org. This is our database in addition to CCC's main website, where you can view these data in interactive charts, maps, also download it if you like. So we're going to move on to some findings, and this is where I'll hand the baton to Maria.
Thank you, Bijan. I will walk you through some of the main findings on demographic and geographic trends on the next couple of slides. And the centerpiece, as Bijan mentioned, of both measures of access across of childcare is a cost. And estimates both for center-based and home-based care are tied into both indicators, cost burden and affordability. If we focus first on a center-based care, which is very often the first choice for families, we see that the price for care for one child in care annually is almost $19,000, which translates to a cost burden of 1/3 of median income for infants and toddlers, for median income for families with young children. What does this actually mean? It means that in addition to a median rent burden, which is for renter households also around 1/3 of our income, families with young children need to allocate another third in order to pay for the childcare cost. And I think this really, thinking about this, will take maybe benefit from pausing for a moment and thinking that 60% of median income for families with young children goes towards these two expenses only. And then if we apply this onto affordability threshold, which is essentially saying that families should not be paying more than 7% of their median household income on childcare, we see that 93% of families with young children in the city cannot afford center-based care, and only 7% can. And then if we move on and take a look at the home-based care, which is slightly above 10,000, so it's twice as cheaper than center-based care, and families who are opting for home-based care, which is also a preferred choice for some families because of many reasons, but still 17% of their median household income would be burdened by the cost of home-based care. And it's really shocking when we think about it. This is a cheaper option, and still 80% of families with young children citywide could not afford home-based care, and only 20% can. And now we will see the how cost burden, the first economic dimension of childcare access, varies across different family types and city neighborhoods. I included the definition that Bijan said already, which is essentially cost burden is the share of median household income for families with at least one child under 5 years of age that would be consumed by either center-based or home-based childcare for infants and toddlers. And as the cost burden essentially, since we have this fixed cost of a childcare, the cost burden essentially varies on the income. And we see a stark disparity between single parent and married couple households. Families with young children headed by single parents have lower median incomes compared to families with married couple households. And we are really talking about 30,000 comparing to 80,000 of annual income. And at the same time, we can see that for single parent families, they would need to allocate more than half of their income to pay for center-based care. And they would need to pay a third of their income to pay for home-based, for care in home-based settings. On both of these, focusing on both of the settings, we see that they're paying more than 2 times more than married couples who need to allocate around 23% for center-based care and 13% for home-based care. And I will move on to another slide where we really see that in communities where median incomes are lower, the cost burden is higher. And on this map, we are showing the cost burden for center-based care for all family types combined, so married couple and single parent combined, which we are calling on a site all families. The darker shade of blue is really showing that highest cost burden threshold between 50 and 65%, while communities shaded in a light yellow are showing the lowest threshold, which is between 6 and 16% of median household income. And we see that families living in the Bronx and central Brooklyn would need to allocate more than half of their income for infant and toddler center-based care. And for single parent households, it can consume entire income. So if you just focus here on the map and keep in mind this darkest shade of blue, and on this slide, I'm showing you that in almost 30 communities citywide, single parents need to allocate more than 50%. So this map for single parents would be almost all dark shade of blue. And in some cases, as I said, almost entire income. I included a snapshot from our database, where in a table view, you can view all the communities and the indicator broken down by different family types. And the similar trend is really there for home-based care, when in 26 communities, single-parent families would need to spend more than 1/3 of their income. And I included a link here for the indicator itself. And now moving on to affordability. I included a definition as well, and I'll just say that affordability is defined as a share of families with at least one child under 5 years of age for whom care would cost no more than 7% of their household income. And we already know that 93% of families cannot afford, 7% could afford for childcare, center-based childcare, and 20% when we're focusing on home-based care. And these are numbers for all families. And on this slide, we see broken down data for single parents versus married couples. And as it was the case with the cost burden, the lack of affordability is even more pronounced for single parent households. We see that only 1%, only 1.3% of single parent households could afford center-based care. And only 5.5% can afford home-based care. Numbers are slightly better for married couples, where 10% could afford center-based care and almost 1/3 home-based care. But we can say that overall, childcare is unaffordable in the city. And I included on this slide a community district map, where we see that almost entire map is shaded in a dark blue. And this threshold is showing that this is a share of families. Only up to 3% of families who are able to afford childcare. This is the darkest blue on this slide. And we see that in over 30 New York City community districts, only up to 3% of families could afford center-based care. And as you see, like there are many other lighter shades of blue, and this second threshold is like from 3 to 7.1%, 9 to 12%. So it's really very low number of families. And I meant to say on this slide that we see that in Manhattan, and I didn't really say it on a previous slide, in Manhattan, we see the highest share of families who can afford center-based childcare. And that is mainly driven by families with young children who also have high incomes in some of the communities. And for example, like in Battery Park, Tribeca, Greenwich Village, median household income is 300,000. So that explains why childcare is more affordable overall in Manhattan. And I will hand it over to Daryl. Give me 1 second. Yeah, I'll hand it over to Daryl, who will walk you on our CCC's approach to federal, state, and local advocacy on these issues.
Thanks, Maria. So I think as we've seen from this report, as Maria just pointed out, the lack of affordable infant toddler care in the city is quite widespread, and it crosses socioeconomic barriers. We saw single versus married households, all ranges of income, many areas of the city. It's really prohibitively expensive. And so there's no one quick fix in terms of policy solutions to make it more affordable, but instead what we really need is holistic change at all three levels of government, city, state, and federal, in both the short term and the long term. And that means reform within current mechanisms to make childcare more affordable, but it also means new mechanisms to make childcare more affordable. And so with that, let's start at the federal level. If you want to go to the next slide. Thank you. So in terms of federal policy considerations, in the short term, what we need is a new stimulus, and we need it from the federal government immediately. Between working families, families who lost income, trying to return to work, who lost jobs, trying to return to work, families are just having trouble affording anything right now, let alone childcare. That on top of the fact that state and localities are at risk of making austere budget cuts that would further reduce what we know was already limited capacity for childcare. And then most directly impactful for a stimulus, we know that childcare providers, the ones who are actually providing the seats, are struggling to keep their doors open and enroll the same number of children, and they need financial help to do so. And all those things could hopefully be helped with a federal stimulus. In the long term, though, looking at the incoming Biden administration, they could have an opportunity to make real change at the national level in terms of childcare affordability. During the campaign, the Biden-Harris campaign outlined an ambitious platform. It included nationwide universal pre-kindergarten for 3- and 4-year-olds, an $8,000 childcare tax credit per child for families making less than $125,000 a year. And most notably for infants and toddlers, they proposed increasing subsidy funding to ensure that no family earning below 1.5 times the median income in their state would have to pay more than 7% of their income for any childcare, 7% being the metric we used in this report for affordability. And so those goals obviously are ambitious, and it depends greatly on the balance of Congress as well as appetite for paying for something like this. But if there's a silver lining in looking at these things long term, we do know that childcare has been shown to have bipartisan support at the national level. In the previous stimulus package, childcare received funding, significant funding. And even in the over the negotiations for another stimulus package, for example, in the so-called skinny version that the GOP presented of a next stimulus, that included funds for childcare. So we know it does have bipartisan support. Next slide. On the state level, what we're looking for in the short term is more action needed on what the state's already received in federal funds. So New York has done a very poor job of getting federal funds that we've received so far in those previous stimulus packages that I mentioned into the actual hands of providers to make a difference right now. They opened up the application process for these grants, but it was very arduous for providers. The distribution, once the grants have been awarded, has been painfully slow. And probably most negatively, it's been limited only to reimbursable expenses, right? The provider has to pay for something and then can use these federal funds through the state to get reimbursed. And what that does is it excludes cash-strapped providers, which are a lot of them. Most often family childcare providers, who are the ones providing the most infant toddler care in the city. And so CCC has been engaged at the state level with many of its partners, and we're continuing to do advocacy on this issue, not only to get the previous dollars that have been allocated for the state out the door and into the hands of providers, but to make sure that any future federal funds we might get through a stimulus are better distributed than they have been in the past. But looking at New York, the state level in the long term, whether or not federal funds become available, the state could significantly expand access to affordable infant and toddler care if it were to make significant building block investments in the industry. So these would include at the state level, raising eligibility thresholds statewide for childcare subsidies, reducing family co-payments and standardizing them across all the counties in New York State to be no more than, let's say, 10%, although we know that 7% is really what's considered affordable, and extend subsidy eligibility to marginalized families, including those who are unemployed, pursuing higher education, who've experienced domestic violence, or have experienced family homelessness. And at the state level, any investment in childcare subsidies gets fed to the city directly through the Early Learn and voucher programs. And that's what is responsible for the most infant and toddler care in New York City. Additionally, the state could expand the state's Empire State Child Tax Credit to children under age 4 and increase it. Currently, it's not available to children under the age of 4. Next slide. Local policy solutions in the short term, the biggest immediate threat on the city front to infant toddler care is from both the city budget and the new award system. And the city must do everything it can to protect the current capacity, which again, we know is limited, but to make sure that we don't have any further loss in the limited capacity for infant and toddler care. And so on the budget cuts, on the budget, that means preventing childcare from any cuts in the budget. And we know it's gonna be a tough budget year. And additionally, the city is in the process of awarding new seats and contracts for childcare. We want to make sure that any redistribution of seats, any newly awarded contracts doesn't result in a net loss of seats elsewhere, especially for the youngest children. But looking at New York City in the long term, we do have a unique opportunity right now to really present a robust agenda. And that's because we have a new mayoral administration set to be elected in November 2021 and sworn in January 2022. And in addition to that, we have 2/3 of the city council is currently term limited, and they'll be turning over at the same time. And so this new administration could put forth a real agenda for early care and education in New York City. And those kind of things could include universal full day year round, emphasis on full day year round. It's not something we have now, for pre-K programs for 4-year-olds and 3-year-olds. They also could leverage all federal, state, and city resources to expand access for infants and toddlers, including increasing childcare subsidies in the city, bolstering New York City's Early Learn and voucher system, directly supporting family childcare providers, and expanding the local childcare tax credits. And lastly, when we're monitoring expansion in the city and advocating for expansion to the city's early care capacity, we always want to make sure that that expansion comes with the parts that maintain a high quality program. And that's a well-compensated workforce, that's a commitment to high quality programming, and that's an active parent engagement. And with that, I think I can turn it over back to Bijan to open it up to questions.
Yes, please continue to put your questions and comments in the chat or in the Q&A. We'll be addressing them as they come now. And I also want to point you to being able to download the brief. If you go to CCC's website, I'll put it in the chat. It's one of the first things that's on the front page, but I'll also give you a direct link here in the chat if you want to download the brief. It goes over the details that we shared during the webinar and probably a few more details about how we came to these numbers that you might find useful as well. So we'll give folks a little bit more time to add questions that we haven't already answered privately or in the Q&A. And we can also say, if you prefer, rather than typing in a question, you can raise your hand. If you go to your your participant view, you can raise your hand to be able to ask a question verbally, and we will unmute you. It looks like we do have a question coming in. So we have a question. How do the numbers change for families that have more than one child under 5? Do we know how many families that is? That's a great question. Maria, would you mind talking a little bit about this? Or even though we didn't do it, how the numbers come that would be able to show this?
Sure, definitely. So I want to say, like, since our analysis is focusing on infants and toddlers, we kept saying that this analysis accounting only costs for one child in care. And as I was thinking, like, what is the likelihood of having like 2 children who are like infants, toddlers in a care? But at the same time, if you're thinking, if you have 2 children, definitely it would double the cost and double the burden. And I'm trying to think about the methodological question of how many. We definitely can, since in the PUMS files, we do have information of I'm trying to think. Bijan, if you want to jump in as well.
Yeah,
I'm trying to think what is the most useful answer.
We use the public use microdata sample file to be able to look for at least one child. But in that, there is information that allows for looking at families with more than one child under the age of 5. We didn't do differentiations for more than one child or one child, because once we start getting to that level of disaggregation, the reliability of the numbers really isn't as reliable as we would like them to be. So we did families with all children with at least one child under 5 years of age. But we can drill down to this further and get back to you.
And I will also say that the same reliability issue was the reason why we focused on median household income for families with children under 5 and not for families with children under 3. So the more granular we go, the less reliable the sample sizes and the numbers are.
Yeah. Thanks, Maria. Daryl, I have 2 questions that I'm gonna kind of combine into one. So one participant's asking, can you explain the subsidy system, who gets vouchers in terms of eligibility, income, and who gets the subsidies? And I think it's pretty complex, so we can kind of give an overview, I'm sure. Related to this, someone's asking, given the crisis, how do you think lawmakers will be allocating resources for early childcare? Do you have a sense of what will cost to implement? So I see these 2 questions as related, though distinct.
So I can quickly talk about what I know about subsidy eligibility, and Maria could possibly fill in the gaps, and we can also always follow up. In New York City, subsidy eligibility is usually determined by 200% of income. Your income is less than 200% of the federal poverty line. That's New York City's eligibility for early learn or vouchers. The issue is outside New York City, it is very much varied across counties, and that's part of the advocacy we're doing, is trying to invest money in the system to raise eligibility, lower co-payments, and standardize things across counties. Sorry.
Do you mind if I jump in? Yes,
no,
I will just. So basically, subsidized, as Daryl mentioned, subsidized system has 2 components. One is early learn, one is vouchers. So voucher eligibility is slightly different than eligibility for early learn. And families who are receiving vouchers are automatically eligible for those if they're already on cash assistance, if they're already like in a child welfare system. So there are several criteria that can determine that family is eligible for vouchers. So also we know that for Head Starts, which are part of this subsidized system, the eligibility is 100% of the federal poverty level. So we can say that early learn system is the one that is really expanding that threshold, helping families who are really low income. If you think about 200% of the federal poverty level, it's about 50,000 for a family of 4. So there are like different levels. So if in some neighborhood we have many families who are above 100% of the FPL, then they might not be eligible for like Head Start program, for example, and they would really benefit from that extended subsidy.
Thank you, Maria. Those are important distinctions. We didn't mention Head Start, but that is that's key. So let's talk about this kind of dual question here. How likely do you think lawmakers will be to allocate resources, and give a sense of what it will cost? So I'll take the second one first. So the costs, so yes or no to some of the costs, are asks at the state level in terms of, there's no direct cost there, right? It's how much do we want to put in. So in the past, we've called for about $100 million. We wanted part of that money to go towards the things we said, raising eligibility for subsidies, and part of it to go towards lowering family co-payments. And we also wanted part of it to go directly towards workforce compensation, which is something we didn't get into in this report, but childcare workers are paid very low wages, and a direct fund to boost those salaries. In terms of what it will cost at the federal level is large. And so there's no clear number there, especially for what the Biden administration has outlined they would like to do. In terms of how likely we think lawmakers will be to allocate resources to early childcare, I mean, this is the question. This is our challenge as childcare advocates. We know it's a tight budget year. The things working for us are twofold. One, the federal government has an appetite to fund childcare. They've done it already in previous stimulus. If we do pass another stimulus, we're hoping to get more childcare funds. And so this isn't necessarily a local resource issue as much as it's utilizing the federal resources for the purposes we want them. And then second of all, it's really about us positioning childcare as essential to both recovery and thriving from the pandemic, right? We need childcare to help combat learning loss. We need, and most importantly, we need it in the immediate short term for economic purposes to get parents and working families back to work. There is no economic recovery without childcare, and highlighting the lack of affordable childcare before the crisis, and that this has all been probably exacerbated now, is hopefully key to getting lawmakers to put their money where their mouth is.
Thanks, Daryl and Maria. Continue putting your questions, thoughts in the chat or in the Q&A box. I just want to highlight a few comments, questions that we're getting, several around the work requirements to get subsidies, and that even if people aren't meeting eligibility requirements for some subsidies, that they might still benefit from from access to childcare. I want to kind of frame this a little bit differently to say, well, what the findings from our analysis really show is that even for families that are not going to qualify because of income eligibility, the vast majority of them childcare is unaffordable, right? Either home-based care, which is less expensive than center-based care. So for the 93% of families in the city where center-based care is unaffordable, and the 80% that it's unaffordable for home-based care, many of those families would not qualify for the subsidy, but it's still outside of their reach, economically speaking. I think some more folks are actually typing this, as I see now after I made the comment. How does affordability in New York City compare to other cities? It seems really bad here, but wondering if the steps New York City has made to expand access have helped reduce the burden on all families. I think that I'll say a comment, and then Maria and Daryl definitely jump in as you see fit. New York City has made important steps towards early education for 3- and 4-year-olds. Infants and toddlers do have some support, but it's the majority of the early education system are 3s and predominantly 4-year-olds. So we're really talking here about infants and toddlers. Those are the youngest, that there are, again, many of them in the city, and parents trying to find balance between caring for them and working. How do we support them? I want to say, Maria, if you can speak a little bit to some of the data.
I was about to jump in because it is one data point that we didn't really include in the slides. So we have around 500,000 of children under 5 in the city. Of those, around 300,000, I believe I'm right, are under 3-year-old. And of those, we have around 23,000 who are in some form of subsidized system, either early learn or receiving care through vouchers. So we are not talking about large number of infants and toddlers at all, who are of large number of families with infants and toddlers who are actually getting the subsidy and support to pay for the care. So these are some of the numbers that are really helping us frame and like why talking about this affordability is important. Because even if eligibility threshold is 200% of the FPL, many of these families who are within 200, they're not getting it because there is no capacity.
And then in terms of childcare costs nationally, I mean, in addition to childcare costs being high in New York City, the cost of living is high too. So I think that even if some of the childcare costs are similar to other parts of the country, housing, food, other basic needs are also high. There are reports that look at whether the metropolitan areas or the states or even nationally the numbers. What we tried to do with this analysis is to go deeper, to go to the community level, because within cities you see vast disparities in terms of who's able to afford or not afford childcare. So our contribution was really at the community level, because in many ways, early education and care settings are community resources that families rely on in their neighborhoods. Though we do know that many families travel to access care in other parts of the city because of convenience, location closer to work or for other reasons. Seeing these community level assets and understanding the affordability at the community level is key. Some more questions in the chat. We'll take a few more. Let's see. Many questions are asking about COVID-19 related issues in terms of our children being tested and how decisions are being made. I think that we might be able to address these with other information that we have outside of the webinar today. We can get back to you on that. I think they're important issues. We do know that maybe this is something, Daryl, you can speak to in terms of like what supports we need for early education providers in terms of ensuring a robust system in addition to the economic supports for families and providers. What are the other types of supports that are key for the early education system in New York City as we still respond to, but then also moving forward, recover from the pandemic?
Yeah, I think in terms of health and safety, there's definitely a push right now to make sure that childcare operators and CBOs, especially that are open, in addition to get the same in terms of attention and support for their health, safety, and well-being that those who work in early childhood centers in schools are. And so that is priority testing. There's talk of hazard pay. There's talk of making sure that they get paid sick leave or aren't forced to take their own sick leave should they have to quarantine. Testing on site. Those are things that I don't think the CBOs are engaging in, don't have as much access to right now as they should. And there's definitely, as CBOs remain open and caring for children, there's definitely something we are prioritizing and that we are definitely echoing their calls for right now.
I think what you mentioned really speaks to some of our advocacy priorities in addition to the affordability component, right? Like a broader set of priorities for early education. Let's see. I think some of the questions are coming in as we're answering them, and looks like in large part we've addressed them. I just want to put into the chat one more time a link to the brief and also a participant feedback form. And this will help us in terms of responding to you. Any ideas that you have for this webinar or for future webinars. It's very helpful if we hear from you about what was helpful and what you'd like to see in the future so that we can create more data resources and policy briefs that are going to be fitting your needs. I'd like to give just another minute for additional questions to come in. We've gotten some great ones so far, and I appreciate everyone for joining.
John, I think I can take one of the questions I see in the chat.
Great.
From Vicky, how do you propose to deal with the capacity issue? Is that something that salary increases will help to alleviate? And it's a great question. And it's why earlier I think I mentioned we had a previous state advocacy goal of getting funding for both workforce compensation and for subsidies, right, separately. It's also why when we're talking about our city priorities that with any expansion of capacity, we want to see worker compensation. money for salaries doesn't necessarily increase capacity, right? What it does is it decreases turnover, it increases quality of life for both the teacher and for the children who's receiving the benefits from the teacher. And so those are things that we definitely support. We obviously campaigned long to get the salary parity win that we got last summer. But to increase capacity takes a separate commitment, right? And so it means a monetary investment in building capacity, right? In incentivizing centers and to add more seats, and it's in building out a system that supports family childcare providers and CBOs, as well as children who receive care in schools. And it means a robust investment specifically to build out capacity, and then with that investment to make sure that workers are brought along with it. It's an issue that we know happened when they built out UPK. They didn't necessarily bring half the workforce with it, the workforce and CBOs, and that's why we had to campaign on parity. And so I would say one doesn't speak to the other, but we want them both to come together when we talk about investments in childcare.
With that, I just want to say thank you for everyone for joining. I hope that the resources that we shared with you today are going to be useful in your own work and your own advocacy. Please do follow us on our social media, join our e-action network where you can receive more information like the briefs that we shared today and other resources and opportunities to take action. There will be many of them as we move through the coming weeks and months. I want to thank Daryl and Maria for your contributions today and to the brief, as well as our colleagues at CCC that helped put together the brief and today's webinar. Thank you all, those of you participating today, for your questions and comments. Please feel free to reach out to us via email or online at our social media with any other ideas and thoughts. We welcome them both today and in the future. Thank you.